Hey everyone, and welcome to Attentive Healthcare Solutions webinar, Defending Your Practice as Health Information Security Through Automation. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. And we also have two add-on productivity solutions for next-gen, ChartGuard and Refund Manager. Next, I wanted to mention an upcoming webinar on October 9th. Online reputation is everything, even for your practice. As healthcare providers in a world that's so enthralled in a combination of both digital resources and consumerism, it's imperative that you are aware of your visual presence and how to effectively manage your online reputation. Join us as we take you through examples and best practices for not only common healthcare sites such as Physician Compare and Healthgrades, but also for LinkedIn and other social outlets. Again, that will be on October 9th, and we'll send out an invitation for that within the next few weeks. Hope to see you there. Okay, so back to today's webinar on defending your practice's health information security through automation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Cindy Kincaid is President of Consulting Solutions at Attentive. So Lindsay, the webinar is all yours. Feel free to get started when you're ready.
Great. Well, thank you, Chelsea. And hi, everyone, and thank you for joining us today for our webinar, Defending Your Practice's Health Information Security Through Automation. I'm sure you all know from the countless articles and reports being released, I would say on a daily basis at this point, that it's official, healthcare is the most targeted industry for malicious cyber attacks. As a result, it's more important than ever to make sure your practice's health information is secure. Now, you might be thinking, our practice is secure. We've never been attacked or had a breach of any kind. But that's the issue. That thinking is the issue. We need to shift our thought process and realize that health information security is a continuous process. It's not something you achieve and then you get to forget about. It's driven by enhancements in technology as well as changes to the healthcare environment. So as your practice adopts new health IT to enhance the quality and the efficiency of care you're providing, it's also equally important to reassess your health information security policies. So in this presentation, our goal is really to help healthcare practices reassess your health information security and consider how automation and other tools that are available can actually help alleviate the burden of keeping your patient's data secure and protect your organization from fines and penalties. We truly understand health information security isn't just a once-a-year compliance review. It's a continuous process that needs to adapt to current and future IT infrastructure trends, and we want to help make that easier for you. So before we even really get started today, I wanted to take a second to take a step back and look at the big picture and ask ourselves, why do we care? Why do we care about our practice's information security? Why are we taking the time today to go over this topic? And the answer is simple, your patients. It's the answer to almost anything we ask ourselves in this industry. Our why is our patients' care, our patient safety, and their trust. Cybersecurity incidents involving health information and patient data affect patient care and may represent a serious threat to patient safety. Failing to address data security issues can also negatively impact an organization's bottom line or result in loss of credibility and patient trust. So if at any point today we start to lose you, because it's a lot of material, whether it be to your email piling up or maybe social media on your phone, take a second to refocus yourself on your why, your patients and their care. All right, well, let's go ahead and dive in and answer the most basic question we have today. What is information security in healthcare? Well, information security is the protection of information and information systems from unauthorized access, use, disclosure, disruption, modification, or destruction. Pretty straightforward stuff, with the key word being protection. Information security is achieved by ensuring the confidentiality, integrity, and availability of that information. So confidentiality, we're referring to making sure this information is not made available or disclosed to any unauthorized person. Integrity, it's a bit different. This is going to ensure that that information has not been altered or destroyed. And then availability, making sure this information is actually accessible and usable upon demand. So it's these three components we really need to focus on to consider your data protected. Confidentiality is what I think most people believe protecting data is. The other two components of integrity and availability can oftentimes be forgotten about, but it's true. If you can't access your data like a ransomware attack, how can you treat your patients? Or if your patient information has been altered, how can you ensure you're providing quality care that isn't jeopardizing patient safety? So all three of these criteria need to be met in order to truly secure your practice from malicious activity. Now, on the last slide, I highlighted that keyword of protection, and that's because security refers directly to protection and specifically to the means used to protect the privacy of health information and support professionals in holding that information in confidence. This could include the tools you have in place to protect your practice, such as firewalls, antivirus protection, etc. Or it could also refer to the actual program and set of policies you have in place at your practice. Security programs, which include implementation of processes, procedures, and tools, and then the monitoring of those systems, are designed to reduce risk. Notice I said reduce and not eliminate risk. And that's because security is not static, and it's going to be continuously changing, which means we will never hit a point where we have a 0% chance of a cybersecurity incident. But with a comprehensive security program in place, we can drastically decrease our odds. Now, the main two parts of any security program will be implementation and monitoring. So this graphic provides an illustrative example for implementing and monitoring information security in your practice. Because assessing your electronic health information confidentiality, integrity, and availability needs requires you to first understand your practice's health IT environment. So this may include the technologies your practice deploys for both clinical and administrative purposes, where those technologies are physically used and located, and how they are used within your practice. So as you assess your health IT environment, think about those situations that may lead to unauthorized access, use, or disruption. These situations will likely be unique to your practice and may be in the form of technology issues. So for instance, lack of securely configured computer equipment, procedural issues. Think of if you don't have a security incident response plan in place, or even personnel issues. So maybe you don't have comprehensive information security training in place for your personnel. And as you think about these situations, try and identify different threats and vulnerabilities to your practice's IT security. To do that, we need to first understand what a threat and vulnerability are and how they differ. So a threat is anything or anyone with the potential to harm something of value. Take an example that I think most of us as healthcare professionals are familiar with, the influenza virus. The flu can infect nearly anyone exposed to the virus, and the extent of the harm caused by the flu depends on that person's vulnerabilities. So comparing an elderly person with a college athlete, most people, I think, would say that the elderly person is more vulnerable to harm caused by the flu. So let's dig into this. What is it that makes the elderly person more vulnerable? Vulnerabilities are going to be weaknesses that, if exposed to a threat, may result in harm and ultimately some form of loss. So it's safe to say a threat is going to exploit a vulnerability. So using that same example, the elderly person's increased vulnerability is due, we could say, to the diminished function of an aged immune system, maybe reduced physical strength, etc. Even in addition to those factors, maybe the failure to get a flu shot may increase an elderly person's vulnerability to harm even further. So you can see the breakdown of the threat in the table on the screen. Once you identify a threat to your practice, you can follow this same process to kind of work through and talk through and identify the associated vulnerability, its impact, and then best practices to combat that impact. So the 5 most common cybersecurity threats to healthcare organizations are as follows. Email phishing attacks, big one, which is malware delivery or credential attacks. You have ransomware attacks. We're all familiar with this, but that occurs when your assets are locked and held for monetary ransom, loss or theft of equipment or data. This can actually lead to a breach of sensitive information. However, this has declined recently. Insider, accidental, or intentional data loss. And then lastly, attacks against connected medical devices that may impact patient safety. Now, I will say one thing is missing from this list that has skyrocketed lately, which are hacking and IT incidents. This includes network hacking, malware downloaded from websites that enable an attack, and so forth, which we'll see later in the presentation is one of the top concerns for our industry today. So for each risk to electronic health information that your practice identifies, you want to try to understand how likely it would be for an undesirable action or event to occur as a result of that risk, and then evaluate what kind of impact that would have on your practice or your patients. So to mitigate each risk, your practice can perform 2 important steps here. The first, review your existing health information security policies and develop new policy statements to address new risks. These new policy statements could require the use of some type of technology, think encryption, further refine who within your practice is authorized to view and administer that information, so different roles or access rights, or even clarify and improve how and when electronic health information is provided to patients or other healthcare entities. And then step 2, institute your updated health information security policies. Put those in practice in your medical practice to mitigate those new risks. This step will help basically keep your practice security policies up to date and current, and decrease the likelihood or the impact of health information being accessed, used, or disclosed in an unauthorized manner. Now, as a starting point of basic cybersecurity practices to implement in your healthcare organization, we identified 10 areas to focus your policies on to mitigate those risks. So I do want to say this list does not prioritize any of these 10 practices in any order, but rather we just wanted to provide the flexibility for your organization to determine your unique security strategy through your own risk assessment and determine how to prioritize these and allocate resources in your own practice. So just a few of these should sound familiar. Your email protection systems, your asset management, your network management, your incident response plan, your cybersecurity policies that you have in place, and then data protection and loss of prevention. Now, unfortunately, our security programs aren't just controlled by the threats and vulnerabilities we identify when assessing our own practices. Being in the healthcare industry, we also have to consider these lovely regulatory requirements when we're creating, shaping, and updating our own health information security strategy. So we are well aware healthcare organizations have to comply with multiple legal and regulatory guidelines and requirements. Some examples here of what your organization might be subject to: directives on interoperability guidelines, our favorite MACRA, mixed meaningful use guidelines, high-tech, even payment card industry or PCI compliance, SAMHSA, and even the STARC law. There are just so many different regulations and guidelines that apply to healthcare security to consider. And while luckily, I will say a lot of them do overlap in requirements, it can be really difficult to decipher. So we want to touch on the very basic requirements of what I call the law of the land, the true governing body of rules for healthcare privacy and security that almost all of the regulations roll up to. So can you guess it? I'm sure all of you were screaming HIPAA, your seats, and you are correct. Now, this is probably an accurate representation of all of your faces right now as you think to yourself, did she really just resort to a HIPAA joke for HIPAA? But yes, I did. Now, as we all know, the HIPAA security rule requires covered entities to assess data security controls by conducting a risk assessment and implement a risk management program to address any vulnerabilities that are identified. So essentially, the HIPAA security rule extends the HIPAA privacy rule to include electronic protected health information, or EPHI. And this EPHI must be properly secured from unauthorized access, whether the data is at rest or in transit. So MIPS and HIPAA both require you to conduct a security risk analysis, and I even included this section where you can confirm these security risk analysis are required annually at least. We get pushback all the time on having these in place by clients, and not only are they the cornerstone of your health information security strategy, but they are the #1 thing that will be asked for during a MIPS, meaningful use, or HIPAA audit. So get those in place. The MIPS audits actually just started last month, and that's going to be the #1 thing they ask for. I also wanted to note that this isn't going away or being forgotten about. The Office of Civil Rights, or OCR, just announced earlier this year that they're conducting audits of covered entities just to assess their compliance with the HIPAA rules and the technologies that have been implemented. So organizations found to have done too little to improve their security of their networks and data over the years are actually at risk for significant regulatory fines. So it's a whole new compliance review program that's being launched. OCR also announced that 2018 had been a record year for HIPAA enforcement. OCR's HIPAA fines and settlements totaled over $28 million in 2018, beating the previous record, which was set in 2016, which was $23 million. 2018 also saw the largest ever HIPAA settlement agreed upon, just meaning this really isn't going away and enforcement is only getting stronger for this. So what's required at a very basic level, aside from the security risk analysis, are what we call safeguards. Safeguards are the solutions and tools used to implement your security policies. There are 3 types. They can be administrative, which include things like new types of training for your workforce. Physical, so we think of new facility controls, new locks on your doors and windows. Or technical, and that we think of implementation of new technology, encryption, things like that. Examples of which are also going to be shown in that table on your screen to the right. Now, once you've identified the scope of those safeguards applicable to your practice, you may have some flexibility in determining which ones are appropriate for the risk you identified. Performing a trade-off analysis between the benefit received from implementing a safeguard versus the cost of implementing that safeguard is one way to make this determination, which I think all practices should be doing. So for example, your practice may not be able to accept the additional burden of an administrative safeguard that would be put on your staff. And you actually may opt to purchase a technology instead that automates that safeguard to mitigate that particular risk. So let's say you don't have the manpower to monitor your network all the time. You may opt for a system that automates that monitoring and that remediation for you. It's all about that trade-off analysis. Regardless of the type of safeguard your practice chooses to implement, it's important to monitor its effectiveness and regularly assess your health IT environment to determine if any new risks are present as well. And then finally, the last piece of the puzzle in regards to regulatory requirements and forces that impact your security strategy is what we have been termed the wall of shame. And no, contrary to popular belief in the ITENIV office, this is not where your name goes if you spell HIPAA like hippo in the healthcare industry. This wall of shame was created by high-tech legislation and requires that the HHS secretary post a list of breaches of unsecured PHI affecting 500 or more individuals. And I included the link on the slide if you wanted to go to it and see it yourself. So as you can see from this screenshot, which I took from the wall of shame, it's exactly what it sounds like. It's a list of practices who experienced a breach. Now you can see how this may impact your practice's reputation if you find your practice name at the top or on here at all for anyone to see. Luckily, this tool was updated last July to only include the last 2 years of breaches. So after 2 years, you'd fall off. But I do want to point out the information it tells you. I mean, you can see the name of your practice, the state, what covered entity type, the amount of individuals affected, the submission date, and the type of breach. Most importantly, as you can see, breaches can be caused by a number of different things, one of which being hacking or IT incident happening on the network, which are almost all of the most recent breaches listed. So keep that in mind as we continue on here today. All right, well, now that we have had a solid foundation on what health information security is and how to reassess your existing strategy, we can look at privacy and security in today's industry. We will look at current report findings and real-world examples of what's going on in today's health IT security landscape. So for that, I'm going to turn it over to Cindy Kincaid, since she is at the forefront of this every day, working with our clients and being on site with them as they address these concerns. So Cindy, it is all yours.
All right. Well, thank you. Thank you, Lindsay. So this is pretty scary stuff, and it's also fascinating items to look at and things to look at, because there's so many different variables and so many things you have to consider on top of your day-to-day treating of patients, which is really what we always hope to still be your primary concern. So if we move on from privacy and security in today's industry, we'll talk about some of the things you need to do. First of all, many of you probably already know this, but we're going to emphasize that healthcare is the most targeted industry today for healthcare breaches. Getting that information on your patients, getting their insurance information is something that the hackers really want. It's easily sold, and it is at the top of the list of the things they're going after, including banking records and all of the other things, which many times they can also get when they're getting into your systems. The latest Beasley Breach Insights report confirms that just what I'm saying, that it accounted for 41% of all breaches were in healthcare. It's worth noting that the healthcare industry, which fell just outside the top 5 in terms of records breached, and that's just the number of records breached, continues to be besieged by a high number of incidents. The attackers focused on smaller targets, resulting in lower numbers, but more entities being threatened. That means that, just because you're not an Amazon or you're not a Cigna or one of those areas, which Cigna we count in healthcare, you are still a target. So if we look at the causes of healthcare data breaches, you can see that hacking and other IT security incidents such as malware attacks were the biggest cause of healthcare data breaches in January of 2019. This accounted for 51.52% of the month's data breaches. 17 incidents in that month occurred. Hacking IT incidents also accounted for the most breach records. That's how they get to most of your patients, through 74.07% of all breach records in January were of this kind. So as we move forward and look at the other, continue to discuss this particular area, you can see that phishing attacks in social media and malvertising. So I'm sure everyone on the call, or at least I hope everyone on the call, knows how easy it is. I can tell you here at iTentive, we've had team members that have fallen for it. There have been things that come in. So phishing attacks are becoming the greater threat to the healthcare industry than any other attack vector, because you let it in. Most phishing attacks on the healthcare industry are deployed by email. Although attacks through social media and malvertising are also becoming more prevalent, particularly if people are accessing it from inside. And it's no longer just the email, it's links on websites, advertisements, and social media that can facilitate phishing. So all of these areas you have to watch, and you have to educate your team members and your employees about what these are and how good they are. We get emails, even at iTentive, every day looking as though they're coming from one of us, coming from our clients. I had one the other day, actually the same particular phishing incident for 2 of our clients, separate clients, different ones, that had the same attack that someone had fallen for. So basically what happens, they'll come in, it looks like it's coming from me to you or you to me. If you're in our email address, they attack it, you go down, you upload a link, and then they have even assumed and taken over your email to send emails out to further people. So it's getting better and more aggressive every day. So if we look at March 2019 breaches, this table shows you just some examples of what just occurred in the month of March. It reported 7 breach submissions made from the 1st to March 11th, according to the Office of Civil Rights Breach Portal. Of the 7 breaches, 4 incidents are a result of hacking IT incident to either the electronic medical record or the network server. And I think if you look at those in terms of that, a lot of times it's basically letting them in. You don't mean to, but by simply opening it up to them or not educating your team members of what to really watch for, and then not having the materials to be able to see if there's a lot of activity going on. And we'll talk a little bit more about that later. So okay, you have these breaches. What is the cost of a breach? That is really the issue, not just to your reputation, which is ridiculous as to how bad that can hurt. We've had some locally that have really made lots of media, lots of news, and impacted a lot of people in the area that we know, even as friends and family, very prestigious offices that can really, struggle once they have had this and even make changes in their ownership as a result. So if we look at the 3 most recent cost of a data breach studies from the Poneman show, and I don't know if I'm saying that right, that show that stolen healthcare records cost the most. In fact, in 2 out of 3 of those years, the cost of healthcare records was over twice the cost of the global average. So if you look at the 2015, $353 per stolen record, the global average was $217. In 2016, it was $355, and in 2017, it was $380. Again, the cost is significant if this happens to your group, and we're none of us protected. So we look at a few real-world examples, and then you wonder, could this possibly be you? Or could this possibly be something that would happen to one of your practices, or even personally? This is something we have to be careful of personally, but it's not as prevalent from the standpoint of how badly it will hurt. So here's an example. A 12-physician pediatric and adult dermatology practice group paid $150,000 for alleged HIPAA violations arising from failure to protect their PHI to the security rules standard. This is just simply they didn't do enough. The group also was required to implement a corrective action plan as well as disclose the breach and provide identity theft protection and credit monitoring services for 1 year for every affected patient. And that's also something that you have to consider. This goes above and beyond the cost of just the record. We continue with those, how can you do? What happens when your IT person leaves? What without someone trained to take over? Firewalls become outdated. There's a lack of monitoring. You're missing patches. Legacy operating systems are in place that are no longer being protected or served. Managing inventory of assets, EPHI leaving, how are you taking care of that? Because sometimes when those people leave, you just kind of take for granted that everything's there and it has to be maintained. We've worked with a number of groups that we've helped bring things back up to speed. And if you're in a HIPAA audit during this period of time, they're not going to care that someone left. The fact of the matter is, as they come in and they audit you and find these things out of date, it will be considered a breach. And we continue on growing and more. So large organizations and acquiring growing at a rapid pace as a result. You get busy keeping things running and forget to protect and secure the data properly. You get too overextended and not paying attention to the networks. You're just trying to keep up. And the network complexities increase. That you're insecure, you're secure. So you're getting more and more security. You're getting more and more firewalls. You're getting more and more equipment. You're getting more and more interfaces. You're contacting more and more third-party vendors to let them have access to your system. Are you managing the security that goes along with that? Do you have all your BAs in place? Is everyone, understanding what the data is and what they're giving access to? And then are they as protected as you are? Because in the end, it's your data. So as part of this, do you manage newly built VPNs? Are you managing new practice wireless networks? How are all of these things being handled in your practice? And continuing on the third party, limit your exposure. So how do I help with this? Well, you limit your exposure and make sure you have a strong and current BA in place. Minimum necessary under HIPAA, but are you providing full access when it's not needed? So understanding HIPAA, understanding what a BAA is, and understanding who has the right to access is important. Third parties may be narrowly focused. One silo niche is, can you give them access to a PC only? Do they need access to the network only? They don't do it all, so don't give them access to it all. Can they prove or ensure compliance for your SRA reporting of some kind? So all of these things you have to consider when you're looking at those third-party IT companies, and I've found that not many people understand that. You may have a conditional BAA, you may have everyone sign it, but in reality, are you digging in to understand that what they're asking for and what you're giving them to? If you're in an enterprise environment where there's multiple practices in the same environment, do they have access to all of it, or can they only have access to what they need? All of those things are items that need to be considered when you're looking at incorporating these organizations and giving them access to your network. So can you relate to this? think we can just move on from there, because it's really, if you're looking at this, this is how I feel from time to time when talking to people and seeing some of the situations we see out there, because it's really hard. And in many of your cases, you just don't have the staff or the time or the expertise to be able to even know if you're doing this properly. So if we look at the whole picture, there are 3 areas that your practice has to be considered. First of all, it's inside your network. So what's going on in your office, in your network in the area. So if you're, and then at the edge of your network, your VPNs, that's items that are allowing people in and out of your network. And then finally, when the things are leaving your network, so it's ePHI, which is electronic PHI. All those have to be considered, and you have to look at each of those individually. So if we talk about the items that are inside your network, you have your antivirus protection. Do you have one that is strong enough? Is it current? Your operating system patching. Microsoft is discontinuing support of server software, Windows software, for example, Windows 7, all of those things. If we move into the supported workstation operating systems, are they current? Is it time for you to refresh? When are those coming out of place, and can they be patched anymore? Because that could be considered a breach if you're on a non-supported workstation. Encryption, are you encrypting your PCs and servers if there's patient data or access to patient data? And that includes data at rest. And what data at rest means is that if it's just sitting there and it's not in motion, it's not being accessed, it's not going anywhere, but it is just basically what it says, it's at rest. That has to also be protected. Someone walks in and picks up a server and takes it out of your office, there's nothing being accessed, but they've got that server. And if you don't have the proper encryption, that's a breach with everyone on that server, even if nothing has happened. Your content filtering, DNS. Are you protecting yourselves from malware, phishing, command and control callbacks? Are your employees educated? Do they know what is going on? Do you have anything in place that can identify if there's a large volume of emails that are all of a sudden being consumed in your organization, or are coming in from one account or going out from one account? Clues that let you know that this is something out of the ordinary, because malware is really easy. Phishing is really easy to fall for. Again, I can't tell you the ones I've looked at and actually called and found out that they were a legitimate email, but I wasn't going to open it because it was just unique enough. I didn't want to pay attention, and I'm pretty paranoid about it, but not everyone is, and some of them are really good. And then your monitoring and compliance reporting. How are you knowing that everything is under control? So if we take a look now at the edge of your network, so we've talked about what's inside, and now we're going to go to your supported firewall appliance. What is your appliance? What is your VPN? All of the data that you have and that's allowing your access out to either your hosting company, to your third-party entities, etc. OS patching on those. Network and bandwidth monitoring, including real time. So, what is your network? How are you getting your data out? Device configurations, backing up and restoring. VPN management. Wireless security. You've got a Wi-Fi. Is it secure? Or is it secure enough? And then your compliance reporting, because when you're having an audit, you have to report on all of these sections. And then finally, leaving your network. Encrypted devices and drives. Do you use laptops? Do people carry them around? Mobile devices, your phones. Are they all passworded? Are the provider's phones passworded? Are they texting patient data? I mean, there's so many things that you can take a look at and have to consider. Your email encryption. Email, when you send it out, are you sending PHI? If you are sending it, do you have an encrypted email package? Or are you just, sending it out and using your own email address? I would be surprised again the number of times I get an email containing patient data. I try to point that out to people and point it out to individuals. We, of course, have a secure email, but that doesn't help if someone is sending it to me unsecure. When I reply, it'll become secure, but it doesn't help. There's a lot of times that I'll even say in our secure email that I'll send emails. Most of the time it's to physician, but I will send an email that has secure in it, and I'll get a notice in 14 days that that email hasn't been opened because they didn't want to take the time to set up the password. This goes back to education. This is important stuff. Faxing. Lots of people forget faxing. Faxing is patient data. And while paper faxing from fax machine to fax machine is not necessarily considered ePHI today, there is a rumor it's coming. But if you're faxing from your from the, say your EHR, and you're sending that, is it secure? What are your connections? How are you getting it there? Your VPN connections, we talked about that earlier, your HTTPS and SFTP, offsite backups. Do you have offsite backups? Are they secure? And finally, you even have to consider your paper. That's just PHI, it's not EPHI. The paper is important. Do you leave things laying around? I can also tell you the practices I walk into. I've firmly said it was in a movie. It's not my line, but I've repeated it often that all you have to do is walk in with a briefcase or a clipboard or something, and you can pretty much in a lot of places go anywhere, including many hospitals. So it's really interesting to see how loose people play that sometimes. So all of these things have to be considered, because once again, if there's a breach, it's easy to have happen, and if you haven't been properly protecting yourself, the penalties are going to go much larger than just the breach. So now we'll move on to how automation can help. Some of these things we're going to talk about you may already have incorporated in some fashion. We're going to tell you some of the things we've done for our clients, and then perhaps talk about how we can help you. So if we move forward on some of the tools, so first of all, let's talk about the benefits of automating. Again, not knowing everyone who's on the call today, some of the practices, you may not have the ability to have the number of staff that you need to do this properly. So first of all, this can reduce your costs. Some of this can do the job of a full-time employee. No one wants to be responsible for all of this, but someone has to be. You have improved reliability because you're covered 24/7 times 365 days. And then there's an increased efficiency. You have to have the ability to be proactive without the threat. So you're looking at things and wanting to see them and coming in, and maybe you'll see that threat when it's coming, as opposed to doing it reactively after it's already happened. So some of the areas that can be automated, because I want to tell you, all of the things we've talked about can't be automated. Employee education, making sure you have a solid HIPAA training and process. All of those things can't be automated, and we can help with, kind of helping you fill in the blanks on that. But for right now, we are going to talk about the things that can be. So software monitoring, threat management, safe browsing policies, remediation on certain events that can be done automatically, ticket generation when the system sees something and so that you can be notified, antivirus protection, and system patching. So how can I kind of help you with these? And Lindsay, that's just a great picture. I laugh every time I see it. So that's Lindsay at UGM, if anyone cares. So this is how we can help you with them.
I wasn't aware this was going to be in here, but this works. We can help.
I thought you might not have been. So all right. So let's move on. So first of all, we'll talk about NetworkSafe and UserProtect. These are some of the tools that iTentive has created to not help with our hosting entity, because we host a number of clients. Some of them I think are on this call, but in addition, this is something that we can deploy whether you're self-hosted, whether you have servers in, at another hosting entity, however you're set up. If we have access, we can also offer these to you. So first of all, device with unified threat management is a UTM bundle. This includes maintenance and support, so it does periodic firmware updates, configuration warranties, and backups. Then we have the data collection device, which does monitoring. It's constantly looking at your system for things that maybe are just not in sync. Self-service portal, so it gives you alerts, alarms, and documentation. And automatic ticket generation. What that means is that if there is something that sparks an alarm in the monitoring, it will send us a ticket that we can either distribute to you, or in cases of some of the agreements, we just remediate that for you. So we have lines of demarcation at the inside and outside ports. We offer safe internet browsing with content filtering and malware protection. Now I want to emphasize, malware is one of those things that we can offer protection, but you still doesn't take the place of education. So this is in conjunction, because it's kind of like if you have an alarm system, but you don't turn it on and you open the door and let the thief in, then you're going to do that. So you also have to work with your team on how to work in conjunction with this. But this at least gives you some real safe protection in front of that, or if it does happen, can help with the remediation. So NetworkSafe offers endpoints that interface with the internet. So this is where, we talked about that inside, now we've talked about the outside. So this has enhanced malware protection. It's DNS-based. It blocks malicious destinations before a connection is established. So basically, if they come in and they've detected something, and let's say you do make that mistake, it won't let it get too far. Devices are protected anywhere on the internet, so this includes your mobile devices. You can set up custom block and allow lists for bypass options. So again, this is something we would work with you on what you want people to be able to do, how you can let them in, and those type of thing. And it provides enforcement and visibility per AD user group, and complementary to electronic acceptable use policies. So the goal is safe internet browsing. So here's some real-world applications. A clinician or staff from your practice is on their work laptop at home or Starbucks or anywhere, and accesses a malicious website or opens a phishing email. You're still protected because it blocks it before it gets into the actual network. So it'll stop it at a certain endpoint, and then that will have to be repaired. We'll have to fix the laptop. We'll have to take care of that. But what it does keep it from doing is infiltrating your entire network. Content filtering for your staff with block and allow lists for websites. So one of the things that we talk about with groups is that we can basically whitelist and blacklist certain sites to keep you and your team protected. And this might be Facebook. YouTube is a big one. Netflix, etc. And sometimes it's hard because there are videos we even have videos on YouTube, but watching them within the network can create a real world risk, and it's becoming greater. And not to mention that it will actually slow your system down terribly. If someone is streaming, Netflix while at work, you probably want to know that. And even if you're the nicest boss in the world and say that's okay on your lunch hour, you want to have it on a separate network because you don't want that impacting your reports or anything else that you're trying to run, because they take an enormous amount of data. So this gives you a lot of extra protection over and above just trying to protect your security purpose. So UserProtect is non-invasive software monitoring agents that protect the user. So it evaluates and alerts. It looks for services failures. It's constantly checking your memory, your capacity, your vulnerabilities, and it looks for OS patching and automatic updates. Provides compliance reporting, ticket integration for alerts, as we talked about in the other areas, and then once more, safe internet browsing, content filtering, and malware protection. So this is basically at all of the various levels that you can put in. So all those 3 levels we talked about, this is going to actually help you in another area as it relates to the UserProtect. So this also includes antivirus, so scheduled virus definition updates. So we have the antivirus put on the system. It keeps them updated and it's consistent. It happens on our systems daily, whether you're looking for these viruses, because as fast as we patch against it, somebody new or so the criminals are out there trying to make another entry point. So there's always something new. And sometimes they're faster than us or any of the others, and that's why you'll see some of the news events and things. But so far, we've been really fortunate, and we hope to continue that way, that we're pretty well staying ahead of it with these scheduled scans, and also the control center operation and management. We have detection and alerts. We can quarantine emails that look suspicious, and sometimes it gets a little carried away, I'll tell you that, but it's better to be safe than sorry. So those are the type of things that when something is quarantined, we have the reports and we can release it if it's later. And a lot of times it's based on complaints that particular entity has had. So the quarantine is a really nice feature. Compliance reporting, and then health grade. And then UserProtect continued with endpoint patching, compliant Microsoft operating systems. We have to be able to keep those up to date because Microsoft is always releasing security patches. And are you getting them in as you need it? And is it consistent? Are all your users doing it? The severity is determined by Microsoft. Critical is 100% approved. CVSS, Common Vulnerability Scoring System. We have a 3-stage process: test, pilot, production, when we're putting in any major patches. Then reporting for accountability and audit readiness. Microsoft SQL Server is manual. It's approved and scheduled. So these are the type of updates and patching that come in. So if it's a SQL Server, it's going to be a manual upgrade, it's not automatic, and it's approved and scheduled. That's just the difference in what we're talking about here, because that is more impactful. But we are monitoring and keeping on track and letting you know when it needs to be done. All of the staging is performed at iTennis data centers, so we check to make sure that and do the remediation testing before it's ever put into your system. And then .NET is not automated and only updated when approved. So these are just the types of upgrades, and then this would be working with your IT team or your IT department or even your general management to determine when these items would be done. So, and then some other applications, HIPAA audits. OCR shows up at your practice for a HIPAA audit. You will now have compliance reporting. So all of these items, if you have them and they come in, you're going to be able to report with the push of a button or with our help, if we're depending upon the level of service, if you're in compliance with your encryption, your antivirus, your supported operating systems, and your safe browsing protection. And then the automated patch deployment. If you have a supported operating system in place that has a vulnerability for an attack, ransomware, this updates it automatically. So these are the type of things that we were talking about from the perspective of the 100% Microsoft compliance in the same area. You know, I'm sure you've all seen it, and if you haven't, then you probably should see it. But you come in that day and you go to shut down your system, and it comes up and tells you you have these updates to deploy. This is ensuring that those are being kept up to date and that if the critical ones are put in automatically. So that kind of takes you through it in terms of looking at the various options and everything. So if we move on to ServerHealth.
I will go ahead and take it from here, Cindy. So let's go ahead and jump right in and look at ServerHealth. So what is ServerHealth? Really, it's a unique monitoring and alerting remediation service crafted specifically to ensure the availability and performance of your next-gen healthcare environment. So this is a bit different from the other two services Cindy went over, and that it's very specific to next-gen. It's like having a 24/7, 365 watchdog for your next-gen environment. It provides monitoring for your servers to do things like maximize uptime and performance, auto remediation when possible, centralized hosted library for all practices to benefit. This also has ticket generation, escalation, or notification. You have quarterly health reporting, again, great for audits and supporting that information. And then a deep dive into next-gen specific services and tasks. So it monitors a whole bunch of things that we have listed here. I won't name them all, but you can pick out some big ones here, like the OLTP, comm services, Rosetta interfaces, SQL Server log, etc. These are the big names in what we see in the next-gen environment of what need monitoring. So you might be wondering why we built the solution or where and how we identified the need for a product like this. Well, we needed a solution for our hosted clients that understood more than basic Windows and hardware monitoring. It really needed to understand next-gen itself. We wanted actionable alerts that mirrored performance or availability issues that impact end users of PM and EHR. We also wanted to economize labor by automating remediation where possible. And we wanted to resolve issues before they impacted our users. Again, being proactive versus reactive. So I'm going to ask you, does any of this sound familiar? Issues with your OLTP, comm services, maybe not updating patient portal or sending prescriptions. Maybe your report server isn't being updated the day before and your HQM data hasn't been refreshed, especially when it comes time to MIPS reporting. Maybe your BBP got stuck or it didn't finish processing. Your SQL Server backups didn't work. And then all of a sudden you're having performance issues. I'm sure almost all of you can relate to at least one, if not more, of these headaches when it comes to next-gen. So how this tool works to prevent this is by installing non-invasive agents on your servers. This goes through kind of the details here, the server operating system level for performance counter services and queues, SQL Server, custom SQL scripts, as well as custom application server scripts specific to next-gen functions. And then alerts trigger communications or optional remediation based on those agents on your servers. So this tool will handle the Windows or hardware layers such as things like user count, terminal server loads, scheduled tasks, print queues, things like that, which we have found a majority of issue alerts come from this layer. But the impact affects the next-gen layer. And it goes without saying, your server and your network infrastructure is the backbone of your business. Interruptions are costly to productivity and dissatisfaction by patients. IT departments are responsible for ensuring uptime and performance, and it all really starts at this layer. But it takes monitoring a step further to next-gen specific monitors, like I said. So some things here, audit health, it tells us if anyone out there is connecting but not configured correctly to write to the audit database, this is a HIPAA concern if auditing is not working properly. Comm services, portal transactions are not coming in, the prescriptions are not going out. Patient care issues if prescriptions are not being processed timely, obviously. Fax monitoring, think prescriptions, labs, or referrals if they use faxing are not going out. Again, major patient care issues if these aren't processed timely. HQM monitoring, ensuring that your HQM portal will be up to date. You want current information for quality reporting to federal and commercial payers for performance programs. ICS, making sure all the scans make it to that local warehouse for backup purposes. We found on occasion orphan images on workstations that have not been uploaded. Interface, think lab results, orders, HIE information flowing. This is obviously going to affect patient care if these interfaces are down. The OLDP, documents are processed for the petitions in a timely manner. Again, major patient care and workflow issues if the OLDP is not functioning properly. And then report health, making sure that the report server is up to date for reporting purposes. Again, following along suit with that HQM idea. And then lastly, we have the Windows event log, looking for stuff in SQL, writing events to the log for analysis, the BBP, checking for the service only since it already notifies of any failure. Primary function here is to schedule EPM reports to run after hours. And then SQL, you have copy jobs, backups, interfaces, data exports, etc. So a lot of really next-gen specific monitoring going on here that it takes to monitor your whole system effectively to the next level as a next-gen client. And of course, the other side of this, which is the alerting side of things. Notification and escalation occur via email. This integrates to our support ticketing system for remediation. And it allows for the extension of our ticketing system to your practice if you want it. So alerts can generate tickets for you with easy escalation to Attentive for higher tiered support if you needed it. We also understand some solutions can't be one size fits all, and that's why ServerHealth is completely customizable to your practice needs. We can do custom monitors, alerts, escalation, or remediation. And kind of to wrap things up here, I feel like, again, we always come back to a why question to gain focus. Why do we care? Our patients. Why do we need to address these vulnerabilities and threats? Well, it's the law under HIPAA. But what I want to end with is why practices choose Attentive. Not every practice has an in-depth experience and knowledge with NextGen under the hood, and they don't know what to look for or monitor. NextGen staff love the capabilities of auto remediation with other custom scripts. Practices really just don't want to deal with it. They have enough other things to worry about. We get it. You're tired of keeping up with changes in NextGen from a technology perspective, and you want confidence that someone's watching it for you. The tools are already custom built and industry standard software to monitor the environment for you. Hey, we were the first group to host NextGen EPM in 1997, so we have that experience. After all, we call ourselves the experts. But lastly, and most important in my mind, is keeping your system up and performing is just as important to us as it is for you. And that's because we know what's on the line. We know how this can impact patient care because we share that same why as you, your patients. So if you are looking for next steps, because believe me, we get it, all this stuff is what we like to call the necessary evil. Again, it's that stuff no one wants to do, but someone has to do it. It's why outsourcing isn't a bad thing in this case and kind of goes back to that trade-off analysis between the administrative burden put on staff versus automating safeguards with tools like the ones we've shown you. So you can let Attentive help if you're uncertain where your practice stands. Go ahead and visit us at attentive.com. Continue to sign up for our informative webinars and blogs, and feel free to let us know if you have any topics that you want covered. We love that kind of feedback and outreach. Consider our 3-day fixed price on-site consultations as well as the products and services we mentioned today. And of course, you can always reach out to us directly, either Cindy or myself. But it looks like we have made it to questions. So I want to thank everyone for joining us today. And I'm going to go ahead and turn it over to Chelsea for any questions that those of you on the call may have.
Great. Thank you so much, Lindsay. And thank you, Cindy. Looks like we only have a couple of questions. So if you have any, please type them in the GoToWebinar control panel, and we'll go through them all. We'll get to them in the order that they were received. So first question. Would the products that you discussed, like NetworkSafe, cover site and internet usage on our guest network when patients use it? Cindy, do you want to answer that?
Yeah, I'll take that. No, typically that's why it's a guest network. Now you can put policies in place, and I have been in guest networks that are restricted to certain, I don't know if it's bandwidth or how they're doing it. It depends on how deep you want to go. So there are restrictions you can put in place, but typically you leave those more open. And that's also the one that if you want to give your employees a place to go that's on their breaks and things that they can use to do personal type of work on Facebook, et cetera, that's also the one that you would have them use.
Great, thank you, Cindy. Next question. Can we let specific people access the websites that are blocked to everyone else? For example, a social media person so they can access social sites that no one else can?
Yes, there are ways to set up specific AD groups. It's a little challenging, but there are ways to do it, and that's another reason also that you can set up a guest network, but it can be done. So we would have to, we just have to work with you on how to set it up and how to make that happen.
Great, thank you, Cindy. And it looks like this might be our last question, unless any more come in. I didn't know MIPS required an SRA. Is that the same as HIPAA requirements? Lindsay, you want to take that?
I can absolutely grab that one. So with MIPS, with this program, under the Promoting Interoperability category, which is that old meaningful use program, to even get credit at all, you have to have a security risk analysis on file and updated within that calendar year. So you don't need to reinvent the wheel and redo an entire security risk analysis each year, but you do need to make sure you do an analysis and update it to fit your current health IT infrastructure and any changes that might have gone into place. So comparing it to the HIPAA security risk analysis, like I said, HIPAA is really kind of the law of the land. So if you're following those requirements under HIPAA, that should be completely fine for your MIPS security risk analysis. But if you have any other further questions on what's required under MIPS, feel free. My contact information is on the screen and reach out.
Awesome. Thank you so much, Lindsay. Well, it looks like that's it for today. So thank you, everybody, for joining us. Really appreciate you taking the time. And if you have any questions after the fact, you can always reply back to my email that I'll be sending out within the next week with a link to the slide and the recordings. Or you see both Cindy and Lindsay's information up on the screen. You can always reach out to them as well. Basically, any way you can get a hold of us, we're happy to help. Just shoot us a note. Besides that, thank you very much for joining us. Have a great day.
Thank you.
Thank you, everyone.